What if a killer could stalk you every day without making a sound, without leaving a mark you can see? It doesn't break into your home or hide in the dark. It lives inside your body, tightening its grip with every heartbeat. Doctors call it high blood pressure, hypertension. You may not feel it, you may not see it, but it's one of the most dangerous health threats today, quietly damaging the heart, brain, and arteries long before you notice. Here's the shocking truth. 1 in 3 American adults has high blood pressure. Many don't even know it. They feel healthy, go to work, raise families, while silent pressure is setting the stage for heart attack or stroke. Why is it called the silent killer? Because most of the time, there are no symptoms. No headaches you can trust. No warning chest pain. Just steady, relentless pressure grinding down the body until something suddenly breaks. Think of your arteries as garden hoses. With normal pressure, water flows smoothly. But if pressure stays too high, the walls stiffen, crack, and leak. Inside your body, those leaks are strokes, heart attacks, and kidney failure. You won't notice it climbing. Blood pressure rises slowly over years. Poor diet, stress, lack of exercise all push it higher. One day it's 120/80. A decade later, it's 150/95, and your arteries are scarred. The scary part is people often feel normal. Running errands, playing sports, laughing with friends, while their heart works harder every minute, straining against invisible force inside the arteries. That's why strokes and heart attacks often seem sudden. The truth? They're the final chapter of years of silent pressure. The body was eroding inside all along, while the person felt fine, until the day it finally snapped. So what exactly happens when blood pressure runs high? Why does this invisible force earn the name silent killer? Let's step into the science and see how constant pressure reshapes your body, one artery at a time. Blood pressure is the force of blood pushing against artery walls. Each heartbeat sends a wave of pressure through your vessels. Normally, it keeps blood moving smoothly like water flowing in pipes. But when pressure stays high, those pipes begin to suffer. Think of normal pressure as gentle waves. But high pressure is like pounding surf, slamming against artery walls day after day. Each strike creates tiny injuries. Over time, those injuries add up, leaving scars and weak spots. These scars make arteries stiff and narrow. Plaque, fatty deposits of cholesterol and waste, stick to the roughened walls. Slowly, arteries lose their flexibility. They no longer expand easily, forcing the heart to pump harder against resistance. Inside the heart, high blood pressure forces the muscle to grow thicker, like lifting weights every second of the day. At first, it seems strong. But over time, the thickened muscle stiffens and tires, leading to heart failure. This is why doctors call it a silent killer. Most people feel no warning signs as their arteries harden and their heart strains. Damage builds quietly until the first obvious symptom is a heart attack or a stroke. High pressure doesn't only hurt the heart. Tiny vessels in the brain are especially fragile. Over years, they weaken and burst, causing strokes. Sometimes, the first sign of hypertension isn't high readings, it's paralysis or slurred speech. The kidneys filter blood every minute. High blood pressure scars these delicate filters, making them leak or fail. Hypertension is one of the leading causes of kidney disease and dialysis. Again, it happens silently until crisis strikes. Even the eyes suffer. High blood pressure damages the tiny vessels in the retina, causing blurry vision or even blindness. Again, most people notice nothing until the damage is permanent. So what causes high blood pressure? Genetics play a role. If it runs in your family, your risk rises. But lifestyle is powerful too. Too much salt, obesity, alcohol, and stress all push pressure higher, straining arteries daily. Lack of exercise also matters. The body was built to move, and sitting all day stiffens vessels and weakens the heart. Combined with poor diet and stress, a sedentary lifestyle is like fuel added to the silent fire of hypertension. The numbers matter. Doctors call 120/80 normal. Between 130 and 139 systolic is elevated. Above 140 is officially high blood pressure. But damage doesn't wait for a line in the chart. It begins earlier, creeping in silently. The cruel trick is that people rarely feel it. No pain doesn't mean no danger. Pressure can stay high for years without symptoms, quietly destroying vessels until crisis hits suddenly. This is the science of the silent killer. Every heartbeat under high pressure leaves a mark. The danger isn't dramatic, but constant, relentless, and invisible until it's too late. So what does this look like in real life? Let's meet someone who lived with high blood pressure for years without knowing, until one day, silence ended with a sudden crisis. Meet David, a 52-year-old office worker. He never smoked, stayed active, and thought he was healthy. For years, he skipped checkups because he felt fine. What he didn't know, silent pressure inside his arteries was rising every year. One afternoon, David felt sudden dizziness and slurred speech. His family rushed him to the hospital. Doctors confirmed a minor stroke caused by uncontrolled high blood pressure he never knew he had. David's blood pressure was 170/100, far above safe levels. Doctors explained the damage had been building silently for years. The stroke was not the beginning. It was the final chapter of long-term pressure. David's story isn't unusual. 1 in 3 adults with hypertension doesn't know they have it. They feel healthy until one day a stroke or heart attack reveals the truth far too late. One pitfall is relying on symptoms. People think, I'll feel it if my blood pressure is high. But hypertension is symptomless for most. Waiting for a headache or chest pain means waiting for damage that's already done. Another trap, blaming other causes. Fatigue must be stress. Dizziness, just dehydration. Nosebleed, dry air. Each excuse hides the truth. High blood pressure may be silently pushing behind the scenes. Even doctors can be misled. A single reading in the clinic may look normal due to stress or calm. Without repeated checks, at home, at rest, the true pattern of high blood pressure often stays hidden. Some people think, I'm active, so I'm safe. But exercise doesn't erase salt, stress, or genetics. Even athletes can have hypertension. Believing fitness guarantees protection is a dangerous myth. The biggest pitfall is waiting for a crisis. Hypertension is a slow thief. By the time symptoms appear, damage is already deep. The goal is not to wait for collapse, but to catch it early before silence turns deadly. The first step against hypertension is simple: measure it. Blood pressure doesn't lie. Even when you feel healthy, a quick check can reveal the silent force pressing inside your arteries. Knowledge is power, the power to act early. Doctors recommend regular checks, especially after age 40. But don't wait for a clinic visit. Home blood pressure monitors are cheap, accurate, and life-saving. A few minutes each week can prevent years of silent damage. Some people have white coat hypertension, where readings spike only in the doctor's office. Others have masked hypertension, where readings look normal at the clinic but rise at home. Regular checks in both settings reveal the truth. Lifestyle changes are powerful medicine. Cutting back on salt lowers pressure within weeks. Less alcohol, more vegetables, and smaller portions all reduce the silent strain on your arteries. Every small choice adds protection. Exercise is a natural pressure-lowering drug. Just 30 minutes of brisk walking 5 times a week can reduce blood pressure by as much as medication. Movement keeps vessels flexible and hearts strong. Regular follow-up with doctors keeps blood pressure under control. Silent damage hides in the background, but frequent visits and blood tests bring it into the light before it's too late. So, what's the message? High blood pressure is common, silent, and deadly. But it's also preventable and controllable. Checking, moving, eating wisely, and taking medicine when needed turns silence into survival.